Assalamualaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be demonstrating you about the examination techniques of the thyroid gland. I will be demonstrating about the three methods which are necessary in order to check that whether the thyroid gland size is normal or abnormal. So first of all we will check that what are the degrees of the severity of the you can say abnormality of thyroid gland. So degrees of severity. First of all we will check degree of severity. So in the normal condition, when the thyroid gland is in normal condition, the isthmus is palpable. The isthmus of the thyroid gland is palpable. Now, in the second degree of the thyroid gland abnormality, the thyroid gland also becomes palpable while palpating the anterior portion of the neck. So, thyroid gland also becomes palpable. Thirdly, what happens that in the third degree of the thyroid gland abnormality or disease, the thyroid gland also becomes visible. You can see the thyroid gland without palpating it. So thyroid gland becomes visible with the naked eye. And the fourth degree is, in the fourth degree, what happens that the outline of the neck becomes enlarged. So outline of neck becomes enlarged. And fifth point, and the last condition of the severity of the disease of the thyroid gland is the goiter, in which the thyroid gland becomes, you can say, very much enlarged. So the last condition is the goiter. So these are the degrees of the severities of the disease of the thyroid gland. Now, furthermore, I will tell you about that. What should be determined in examination of the thyroid gland? So, following are the, you can say, factors which are determined while examination, during the examination of the thyroid gland. So, these are the, first of all, size is determined, whether it is normal or not. Secondly, if there is presence of any soreness. Thirdly, the presence of lymph nodes is palpated, that whether the size of lymph nodes are normal or not. So presence of lymph nodes are checked during the examination of thyroid gland. And after the presence of the checking the presence of the lymph node, that whether these are normal in size or not, the fourth one is checking the symmetry of the thyroid gland. So now I will be explaining you about the three methods of the palpation of the thyroid gland. So number one method is the, first of all, we have to place these 2 to 5 fingers behind our neck, behind the, you can say, sternocleidomastoid muscle, which is present at the you can say at the lateral portion of the neck. So behind the posterior posterior surface of the sternocleidomastoid muscle, we have to place 2 to 5 fingers. Then this thumb must need to be anterior to the thyroid cartilages. Both thumbs must need to be anterior to the thyroid cartilages, and after this we should palpate the isthmus in a vertical direction. Now during the method 1, we must make sure that patient must need to take a sip, because when the patient would take a sip, the larynx would go upwards and along with the thyroid gland, and you can say it would be easier to slide the fingers on the thyroid gland. After this, the method number 1, I would like to tell you about the method number 2. So in the method number 2, first of all, we have to hold our head with the left hand. After holding with the hand, our neck with the left hand, we must need to tilt the head slightly forward in order to relax our neck muscles, and you can say making the palpation of the thyroid gland more easy. After this, now we have holded we have holded our head with the left hand. We have tilted our head in the forward position. After this, we must need to start our examination process by the right hand. So, with the help of the thumbs, we palpate the right lobe of the thyroid gland, and with the help of the fingers, we will palpate the left lobe of the thyroid gland. This is the second method. After this, there is a third method. In the third method, doctor must need to present behind the patient, and thumbs should be placed posterior to the sternocleidomastoid muscle, and the palms must need to be facing lateral to the neck muscles, and after this, the fingers should be anterior to the thyroid gland in order to palpate this. So this is the third method. So these were the three methods that how should we palpate or you can say diagnose the thyroid gland. So now we will be studying the examination of the lymph nodes of the neck. That what are the lymph nodes which are present in the neck region and how to you can say palpate it. So examination of lymph nodes. Examination of lymph nodes of neck. Lymph nodes of neck region. So, what are the lymph nodes present in the neck region? First of all, there is a pre-auricle. First of all, there is a pre-auricle lymph node which is present anterior to the ear. So, number one is the pre-auricular lymph node. Pre-auricular lymph node that is present anterior to the ear. After this, we have the, you can say, post-auricular lymph node which is present posterior to the ear. So these are the two lymph nodes which are present anterior and posterior to the ear. After this, we have the lymph node present in the occipital region. Here in the behind the you can say occipital bone. So in the occipital region, the third lymph node is present. Occipital lymph node. Then right beneath the ear, there is the lymph node present which is known as the tonsillar lymph node. So number 4 lymph node is the tonsillar lymph node. After this, after the tonsillar lymph node, there is a lymph node present in the submental area. Here at the submental area, lymph node is present. So this is the submental lymph node. And sixth one, the submandibular lymph node. This is, we know that this is the mandibular bone which you can say constitutes our jaw. So beneath the submandibular bone, here the lymph node is present which is known as the submandibular lymph node. This lymph node is known as the submandibular lymph node. So now the seventh one. The seventh lymph node is present at the cervical region of the neck, at the posterior portion of the neck, which is known as the cervical lymph node. Cervical lymph nodes. So these were the lymph nodes which are present in the neck region, and we have to palpate it during the examination of the thyroid gland or examination of the neck region in order to, you can say, determine that whether the size of these lymph nodes is normal or not. So hope you have understood all the topics well regarding the examination of the thyroid gland, and you should subscribe to my channel for further medical information. Thanks.